Before supervising self-administration or administering medication to the person you are caring for, there are several things you must do or consider. Why is the person taking the medication? What is the person's medical history? What are potential side effects or potential adverse reactions associated with the medication that is to be given? Where is the reference if you need to look it up or to refresh your memory? What should you do if something happens? In most instances, one of two actions will cover unexpected occurrences. If you notice a change or have a concern, document it in your progress notes and notify your supervisor for direction. If the situation is life-threatening, call 911 and start CPR or first aid, whichever is applicable. When emergency help arrives and takes over, then document and notify your supervisor. Using the 5 rights plus 2, a tried and true set of safeguards, you can quickly and easily avoid most common sources of medication errors. Every time you administer medication or supervise the self-administration of medication, you must confirm that you have the right person, the right medication, the right strength and amount, the right time, the right route, the right documentation, and the right reason. An accurate and up-to-date MAR is essential. Your initial step is to match the person's name to the name on the MAR and on the prescription label. From this point on, you will be matching all of the information covered in the rights to your MAR. Match the name of the medication on the label to the name of the medication on the MAR. Match the time on the MAR to the time on your watch. Match the strength of the medication and how much of the medication you are to give from the MAR to the same information on your label. Match the route to administer on the MAR to the route you are preparing. Be sure you have complete instructions from the prescribing practitioner on both the MAR and the label. Instructions such as "take as directed" are not acceptable, and written clarification from the providing prescriber is required. Only give medication for the symptom or illness for which it was prescribed. Let's take a few minutes to discuss each of these rights in depth. The right person. To reduce the risk of a medication error, never assume the person standing before you is the person named on the MAR. Before administering or supervising the self-administration of a medication, it is imperative that you first identify the person by photo identification unless you know him or her. Just saying something like, "You're John, right?" can lead to mistakes and medical errors. The person could be confused, misunderstand you, or there could be more than one John that gets medication at this time. Always be sure to match the name of the person with the name on both the MAR and the prescription label. The right medication. Always compare the name of the medication printed on the label with the name of the medication recorded on the MAR. Take your time and do it carefully. There are many drugs that have similar sounding and similar looking names. For instance, Celexa, which is a serotonin reuptake inhibitor used to treat depression, and Celebrex, which is a non-steroidal anti-inflammatory drug used to treat osteoarthritis and rheumatoid arthritis. It is a distinct possibility the person you may be caring for could be prescribed both of these medications. In addition to carefully comparing the name of the medications on the label to the name of the medication on the MAR, listen to what the person has to say about the medication. If he or she says, "I usually take one blue pill and you gave me a pink pill," stop what you're doing and recheck the order. Perhaps the pharmacy is using a different pharmaceutical company and their generic version is pink rather than blue. Or perhaps the wrong medication or dosage was dispensed. Whatever the reason, it's always prudent to double check when a person states medication is not correct. A quick check of the order, and if needed, a call to the pharmacy, can prevent a medication error or worse. The right dosage. Always match the strength of the medication and how many tablets, capsules, etc. you are to give on the label with the strength and number recorded on the MAR. You will often find that with medications for seizures, mood disorders, and psychotropic drugs, the dose may vary from morning to evening. It may be the strength of the pill or the number of pills to be given. Many of the medications in these categories may cause drowsiness, and a lower dose is ordered in the morning with a higher dose ordered in the evening before bedtime. The right time. Always double-check the time that medications are due. Some medications may only be given in the morning or at night rather than several times during the day. Carefully read the time and determine whether it is an AM or a PM medication. Some companies will use military time to help avoid confusion between the AM and the PM medications. For instance, a medication due at 7 AM would be scheduled for 0700, where a medication due at 7 PM would be scheduled for 1900. No matter the method used, always be sure that you administer or supervise the administration at the correct time. You have a 1-hour leeway on both sides of the scheduled time. A 7 o'clock medication may be given as early as 6 o'clock or as late as 8 o'clock. If the medication is given outside of these parameters, it is a medication error. When assigning a time for a medication to be given, you must consider the therapeutic needs and the practical needs. For therapeutic purposes, the right time would ensure that appropriate levels of the drug are maintained in the person's bloodstream. If the medication is for seizures and is ordered for twice a day, try to be as close to 12 hours apart for the medication. For instance, 7 AM and 7 PM. For practical purposes, the right time is the one that is convenient for both the staff and the person. Naturally, therapeutic goals must take precedent over practical considerations. Generally, if the medication needs to be spread out over a specific time, the doctor will write the order giving specific time instructions, such as every 8 hours rather than 3 times a day. The right route. Medications may come in different forms and strengths based on its intended route. The route that you give a drug affects how fast it is absorbed into the bloodstream. Generally, when this becomes an issue is when you are dealing with licensed healthcare providers. Doses may vary dependent on the route, and provider must be sure he or she is administering an appropriate dosage. As an example, 15 milligrams of Vistaril extended release by mouth is appropriate, but 15 milligrams of Vistaril given IM could cause a major adverse reaction, including death. Read the route and instructions carefully. Be sure the medication is administered by the route and in the manner that is on the label. You would not want to crush or allow a person to chew an enteric-coated tablet, or open a sustained-release tablet to mix the granules into food or beverages. This action could alter the drug's absorption rate, put too much drug into the bloodstream too quickly, or reduce the drug's overall effect. Remember, you should never crush, cut, or mix any medication without a doctor's order. Chewing is considered crushing also. If you notice the person you are taking care of is chewing his or her pills, contact the doctor's office right away for direction. Right documentation. For an unlicensed person to be authorized to administer or supervise the self-administration of medication to a person being cared for under the auspice of the Florida Agency for Persons with Disabilities, specific documents must be completed and maintained for the individual you are serving. These documents include an authorization for medication administration form, which lets you know the amount of assistance required, informed consent for medication administration, which gives you permission to provide the medication assistance services, and written instructions or orders from the prescribing practitioner. This may be in the form of a doctor's order or a copy of the prescription. The right reason. Always be sure you are giving the medication for the reason it was prescribed. A couple of examples would be: the doctor wrote an order for 20 Lortabs for pain following surgery. The individual did not need all of the medication, but it wasn't destroyed. He currently has a bad toothache. Even though it is his medication and it was prescribed for pain, you may not give him the drug because it was prescribed for pain associated with his surgery. Another example would be PRN Tylenol, prescribed for a fever over 100. Even though Tylenol is used for headaches, you would not be able to administer or supervise the self-administration for a complaint of a headache. When dealing with an over-the-counter medication like Tylenol that has multiple uses, be sure to ask the doctor if it is permissible to use it for more than one situation, for instance, pain or fever. If it is okay, be sure to ask him to write the order so that it will allow for use in either situation. The 5 rights plus 2 will help you prevent most medication errors if they are followed each and every time you administer or supervise the self-administration of medications. But in all actuality, they are just basic levels of protection. We are going to look at some additional measures you should take to help avoid medication errors. The first of the guidelines deal with storing and preparing the medication. Storage guidelines. The careful storage and handling of drugs will maintain their stability and potency. Some medications may be altered by temperature, air, light, and moisture. Always be sure to follow the manufacturer's recommendations and drug-specific precautions. Always keep drugs in the containers you receive them in from the pharmacy. Be sure the caps are closed tightly, and if you see a little cylinder in the container, leave it. Most likely it is used to absorb moisture and to keep the drug fresh. Store medications at room temperature, unless the label instructs you to refrigerate them. State law and APD policy require that opioids and controlled substances be locked in a container that is locked within an enclosure, double locked. APD rules require that controlled substances be separated from routine and over-the-counter medications. Preparation guidelines. Is it out of date? Then it's out of the question. Always note the drug's expiration date. Never administer a medication that is outdated or expired. Generally, this is not a problem if the medication is a prescription drug that is taken routinely. However, it can be a problem when a PRN medication is prescribed but hopefully rarely used, such as an EpiPen and Diastat, or in the case of over-the-counter medications. A helpful hint: when a store significantly reduces the price of an OTC medication, double-check the expiration date before you buy several bottles, or you may end up with a cabinet full of expired medication. If it looks or smells contaminated, do not give and do not put it back in the container. If, when opening the original package, there appears to be evidence that someone has tampered with it, never give the medication. Return the medication in its package to the pharmacy for an investigation. Don't give it if it's not on the MAR. Remember, for a medication to be placed on the MAR, whether it is an OTC, routine, or PRN drug, you must have a doctor's order. You should always check the medication label 3 times. When you take it from its storage place, when preparing it for the administration or supervision of self-administration, and before placing it in the cup or handing it to the person, before returning it to its storage place. It is essential that everyone's medication is stored in such a manner that it is easy to retrieve the medication and there is a system to prevent you from pulling someone else's medication out. When preparing medication for administration or supervision of self-administration, there are things you need to take in consideration. Only prepare medication for one person at a time. Prepare the medication in an area that is quiet and free from distractions. Use the 5 rights plus 2 each and every time. After pulling the medications, administer them to the person. Be sure he swallows all the pills and capsules and check before you sign them off in the MAR. Never leave pills at the bedside for a person to take later. You must observe them swallowing the medication. As soon as the person takes his medication, document the administration in the MAR. Then return the medication to its secure storage location. When you have completed these steps, then move on to the next person. When preparing medication for administration or supervision of self-administration, there are things you need to take in consideration. Only prepare medication for one person at a time. Prepare the medication in an area that is quiet and free from distractions. Use the 5 rights plus 2 each and every time. After pulling the medications, administer them to the person. Be sure he swallows all the pills and capsules and check before you sign them off in the MAR. Never leave pills at the bedside for a person to take later. You must observe them swallowing the medication. As soon as the person takes his medication, document the administration in the MAR. Then return the medication to its secure storage location. When you have completed these steps, then move on to the next person.
You are taking care of Anna, a 67-year-old lady with a history of intellectual disability. You notice that she is chewing up her pills. When you mention it to her daughter, she states, "Don't worry about it. She always does that." What should you do? Perfect. Chewing is considered the same as crushing a medication. If you do not have a doctor's order stating it is okay for her to chew her meds, you need to call. It can be dangerous for her to chew extended-release medication. Chewing may also decrease the effectiveness of medication that needs to dissolve in the intestine rather than the stomach. Perfect. Chewing is considered the same as crushing a medication. If you do not have a doctor's order stating it is okay for her to chew her meds, you need to call. It can be dangerous for her to chew extended-release medication. Chewing may also decrease the effectiveness of medication that needs to dissolve in the intestine rather than the stomach. You are caring for John, a 30-year-old male with a history of cerebral palsy. He has an order for Tylenol, 325 milligrams. Take 2 tablets every 4 hours as needed for fever over 100.5. John states his muscles are spasming and are very painful, and he can't sleep. The baclofen just doesn't seem to be enough. It's 2 a.m. in the morning, and he would like to have 2 Tylenol to hold him over until the morning when you can call the doctor. What do you do? Perfect. You are only able to give a medication for the reason it was prescribed. A good rule of thumb is to ask the doctor when he writes an order for an over-the-counter that may be used for multiple uses to include all of the permissible uses. For instance, Tylenol for pain or fever over 100.5.